My name is Carly Iliades, and I'm the program head for neonatal nursing here at BCIT. So next slide, please, Julie. So neonatal nursing is a subspecialty of nursing that works with newborn infants born with a variety of problems, ranging from prematurity to birth defects, infections, surgical problems. Our program is very similar to a lot of the other programs where it's for practicing registered nurses wanting advanced neonatal certification or to complete their Bachelor of Science in Nursing. We also as well do have undergrads in our program. They can currently take our first 2 theory courses during their BSN. And same with what Luda said, we do prefer 6 months of relevant work experience in an acute care setting, but that's just a preference, and we do have new grads and undergrads in our program. So if you enjoy working directly with infants and their families and can apply sensitivity and compassion in a high-stress work environment, this program might be for you. I think we maybe could go to the next slide. I think I already covered on that. So the neonatal program is designed for nurses who are interested in working in the neonatal intensive care unit. As a neonatal nurse, you would care for premature or sick newborns from birth up until discharge from the hospital. So the neonatal period is technically considered the first month of life. However, neonatal nurses care for infants from birth until discharge, which in some cases could be several months or even up to a year. For the most part in the NICU, we do care for premature infants, but we do also look after term newborns who have certain risk factors such as infections or congenital heart defects or other birth defects. People who generally enjoy working in this area obviously probably really like babies, but also really enjoy working with and supporting families. Family-centered care in the NICU is really at the forefront of what we do. It's a very fast-paced environment, but it's also very scheduled, and we work in a very methodic and organized way. You could care for infants in the NICU that are extremely premature, that require mechanical ventilation, central venous access, multiple medication infusions, right up to babies that we call feeders and growers who are just learning how to feed and maybe need to grow just a little bit before they can go home. Another major focus of neonatal nursing is providing trauma-informed and developmentally supportive care to infants and their families. We've really learned a lot over the past several years about how stressful and traumatic the NICU environment can be for both infants and their families. So one of our main focuses is really providing supportive care to ensure positive neurodevelopmental outcomes. These little babies' brains grow so much while they're in the NICU, and we know that the care that we provide as neonatal nurses really does have a tremendous impact on both their short and long-term outcomes. So the neonatal program is comprised of 24 credits. There's 18 credits of core courses, which are a combination of both theory and clinical, and then there's 6 elective credits. For these elective credits, you can choose some of our neonatal options, or you could also choose electives from other specialty nursing programs such as pediatrics, perinatal, palliative care, breastfeeding. There's really lots of options to choose from. There are there are also multiple paths to becoming a neonatal nurse. Like I said before, you can take our first 2 theory courses in your undergrad program. You might end up doing your final preceptorship in the NICU and then go right directly into working in a NICU after graduation. Or you might finish your BSN, work for a while in another area, and then decide to specialize. So as mentioned earlier by the other programs, there is the option to take our courses one by one. And then there's also the option of health authority sponsored compressed timeframe programs. And then we also just have some testimonials from our previous students. So one of them said, I felt that this course built the foundation of my knowledge regarding the NICU specialty. I loved how there was a quiz after each module to test my understanding of the content. Another student said, I found the education extremely useful in going into a career in the NICU. I also appreciated the amount of clinical and preceptoring time we got. And then finally, it was a great learning opportunity. The instructors were fabulous. It was quite fun, and now I have the greatest job ever. And then lastly is also just my contact information and the contact information of our program assistant, Sandra. So please feel free to reach out to us at any time. We're happy to chat with you and find the right path for you.